Hi friends, let's talk about certain misconceptions about cervical incompetency. It's a condition which leads to what is called as second trimester abortions. Usually it's a painless condition but causes lots of pain to the couples who have undergone this unfortunate event. So today we will be discussing certain myths about it, and let's see if we can throw light and reach to some kind of conclusion. I have Dr. Shivkanya with me, who was researched into certain myths about the cervical incompetency, and she'll be asking those questions, and we'll be discussing on the same line.
Hello, sir. How common is cervical incompetency and what is the causes for it?
Well, cervical incompetence is one of the rare conditions of the cervix, which can lead to mid-trimester abortion. We see it when we talk about the conditions which causing second trimester abortion. This leads to almost like 15-20%. But as such, for all the conditions leading to abortions, if you take, it is only around 1 to 2%. So it is pretty common. The most common reasons, no, attributable reasons, because there are many reasons which most of the patients are not aware of. So most common attributable reasons are if the patient has undergone repeated abortions, repeated procedures on the uterus like hysteroscopy, cervical dilatation, or DNC, what we call dilatation and curettage, or she has undergone any procedure on the cervix. So this is all what we call it iatrogenic or surgical reasons. Then also this is common in patients who have some connective tissue disorders like Marfan syndrome or any other connective tissue disorder leading to very flexible joints. So that can be ascertained when we do a physical examination of the patient. But 90% of the time, we have patients who have no reason why they should be having a cervical incompetence, and we generally see them only following a bad outcome, or whenever we are doing a scan, we may sometimes pick up the cervical incompetence.
Okay. Then what will be the signs and symptoms of this cervical incontinence, sir?
Generally there are no much signs and symptoms of cervical incompetence. So if I can make an analogy, cervix is a part which holds the pregnancy up to ninth month, so that the pregnancy doesn't fall apart, the baby doesn't fall out. So cervix needs to be nice and tight or strong. Cervix is not made up of muscles. It's totally not made up of muscles. It has lots of connective tissue, like fibers, which are the major component of the cervix. Whereas muscle do add certain component to it, but mainly it is a fibrous tissue. So if the cervix is not strong, then it can allow the pregnancy to pass out by itself. If you imagine, if you fill up a balloon with water and you tie the, keep the neck long and straight, as the water keeps increasing, if the, the neck is not strong, it will slowly open up. Okay, as it opens up, and then the whole pregnancy or the whole water or whatever content can pass out. Similarly, as the pregnancy progresses, so first trimester generally is not a reason for cervical competence is not a reason for abortion if it is first trimester. So as the weight of the pregnancy keep increasing, like around 14, 15, 16 weeks, the weight of the pregnancy is increasing. Slowly it will make the cervix open up, and then the pregnancy passes out. Usually we get a complaints from the patient telling that there is some kind of increased discharge which is happening. That is because the mouth is open and the infection is building up, or they can start feeling some kind of a lower abdominal pressure symptoms. Means because the pregnancy is passing down and it's causing pressure on the lower part, you feel a pressure. So discharge and the pressure are the most commonest symptoms. Pain is never present. Pain is not the component of a cervical incompetency, and if the pain is there, then it is most likely not a cervical incompetence. But yes, when it is a final stage, when suppose the abortion is happening, when the pregnancy is passing out through the cervix and vagina, maybe for half an hour, 45 minutes, they will tend to have a pain, but that is usually very late in the stage of incompetence. Yes.
And is there any specific diagnosis tools? How to diagnose?
See, unfortunately, the most of the diagnosis we are seeing in our practice is a retrospective. Andre, already previous pregnancy, certain bad outcome has happened, and the patient are coming for a second opinion to us. So we look at the history, as I said, and mainly the history during the pregnancy. In sense, what was the event which followed? When was the scans done? And what were the symptoms you had? How long did the pain last? So these are some things which you need to know before we diagnose the condition of cervical incompetence. It is retrospective. What we follow in our clinic is, as I said, the cervix starts dilating somewhere after 14-16 weeks. We have a very important scan to be done between 11 to 13 weeks, which is called as NT scan, during which we measure the cervical length, and preferably we measure it transvaginally, because that gives us the proper length of the cervix. Now, we always call our patients back by around what is it called 14 to 16 weeks. This is the time when we do a test called as a pressure test. We look at the cervix and the length and the transvaginally. We gently apply some pressure on the abdomen and see if the mouth of the cervix is showing any kind of a opening or softening or dilatation, and that gives us a clue whether the cervix is strong or not. And it requires quite an amount of experience to do this, and we've been doing this for quite some time, and we have picked up cervical incompetence very early, even in the first pregnancy, rather than a retrospective diagnosis. So if the cervix is opening up or loosening, we know that yes, this cervix is not strong enough to hold the pregnancy till 9 months, and in that case we can suggest them certain corrective therapies. So yes, but the patients do complain that yeah, we have to come quite often, and after 11th, 12th week we are again calling them after 3-4 weeks. But it's better to be cautious than to regret this kind of outcome a little bit later. Yes, this requires a bit of expertise to diagnose the condition, but in the first pregnancy also we could diagnose and prevent a bad outcome.
Okay. Oh, thank you, doctor.